We'll look at Singapore perspective on the global patient safety challenges and actions. So as you know, Singapore actually benefit a lot from the initiative, patient initiative that comes from WHO. We have mentioned, we talked about the global patient safety challenges, and there is also the international patient safety goals, of which WHO plays a very important part, the 6 goals as listed here. And a very important action plan that comes in 2021, Singapore actually benefit from it, is a comprehensive boost to the patient safety culture and a reference for our Singapore healthcare to better fine-tune our practices. And these 7 strategies, I will go through them. The first one relating to policy and mindset. How can we change that? The system, the high reliability systems. How can we make our processes better? In terms of patient partnership and engagement, staff training, information management, and collaboration and platforms. So Singapore healthcare system, we have 2 public healthcare clusters. Although our Singapore system is quite good in terms of providing care, I think there's still harm. And we're trying to reduce the harm as much as we can through our patient safety initiatives. So number 1, the policies. In Singapore, we have the national SRE system that provide cross-sharing of the sentinel events. We also have a medical act that provides legal protection for members and findings from the Quality Assurance Committee that's appointed to review these SREs, the serious reportable events. At the same time, we have a new Healthcare Services Act that has come out to look at how we can improve the delivery of new and innovative healthcare services like telemedicine in terms of providing patient safety as well. At the cluster level, for example, in SingHealth, there's a policy that we need to do patient safety engagement. We need to report it within our most senior meetings twice a year. And one of the key things is the leadership patient safety walk round. This is one of the categories that we look at, and we encourage our leaders to do it. Others including the serious reportable events, the audits and assessment we have to do, and training programs and other various engagement, including patient safety walk, to encourage and motivate patient safety activities. So it boils down to actually these few factors. The leadership must have the commitment for patient safety, and there should be a culture, a mindset of zero harm. At the same time, we should set up a system, a learning system, and also a high reliability system while we mobilize the resources. So you can see at the sweet spot is when the leadership is able to mobilize the resources and get the system and culture right. So very important, the patient safety culture is the mindset, is this mindset for zero harm. First, do no harm. In SingHealth, we call it target zero harm. And leadership commitment to zero harm is important. The unwavering commitments of leaders at all levels to zero harm is essential, as what is stipulated in the first strategy of the Global Patient Safety Action Plan. So, and which is why when we set up the Institute for Patient Safety and Quality in 2017, the most important thing we want to do is to embed a strong patient safety and quality culture of zero harm, and of course a system, and also provide leadership guidance as well as to promote collaboration. So what is target zero harm? Target zero harm means prevent zero harm events of any kind as listed here. Zero harm is an aspiration. If you don't aspire for zero harm, then you will never reach excellence. In fact, we have a SingHealth Patient Safety Pledge for target zero harm as listed here. Second, relating to high reliability systems that protect our patients daily from harm. So in Singapore, our MOH has started the Ensure Safer system, is to advance Singapore healthcare towards high reliability beyond our previous JCI accreditation framework. We focus on looking at change. We focus on looking at improvement. And we are not focused on accreditations, but rather the opportunity to improve at every stage for our healthcare. We did a survey, we have run this for about 2 years, and we found that our assessment is actually more effective than the previous accreditation surveys in trying to identify gaps for us to improve and in reducing stress levels to the staff and encouraging open communication. So staff are more encouraged to discuss about what their gaps is rather than to hide the gaps in the accreditation survey. In 2015, we suffered a very serious infection disease outbreak where we harmed many patients, about 22 of them, 22 patients in Singapore General Hospital, our flagship hospital, from a hepatitis C outbreak. And the cause is lapses in infection control. And that's why we felt that there's a need to establish very high reliability system. We established cross-institutional survey, audit, and assessment for safer system in terms of hand hygiene and environmental hygiene and various other aspects as well as listed here. So this is not just a audit of hand hygiene and environmental hygiene. It's also about sharing of best practices. It's about having a collaborative framework using innovations like apps to help us. It's about a cluster learning system. And when we look at it, having a cluster learning system where we share best practices, where we discuss together how to improve, we find that our hand hygiene rate has gone on to very high levels that we have never seen before, way above 95%, when in the past we were struggling at around 70 to 80%. So similarly for environmental hygiene index is also very high as computed by one of our index here. So important in a learning system to be able to share best practices. So here we harmonize and share materials to improve CORT in 4 areas: patient care, competency, patient education, and policy supplement. And we are able to achieve very good rates of hygiene for the CORT and a very low rate of CORT infection. So this is what I think is very important about to establish a high reliability system. Is actually a learning system where you are able to detect problems and analyze them and improve them. And there is psychological safety with just culture to promote that, as well as the academic culture of analysis. And then when we have gaps, we will do quality improvement, and we will have effective change management and the platform to learn and skill and spread. It is important to have this virtuous cycle and to be able to create this itself. And so, as I mentioned, our cross-institutional infection control audit is almost like a high reliability system where we achieve excellence in hygiene. So why is we view it not just as an infection control audit? Our staff incorporate high reliability principles. What are high reliability principles that we have learned from the other industries? We encourage culture of safety, preoccupation with failure. We engage frontline staff. We are committed to resilience. We do a couple of situation awareness, and we have continuous learning, and we defer to the experts for the advice. Number 3 is relating to assuring the safety of clinical processes. Here, I will just give an example, which is the WHO High 5, which is the correct site surgery protocol. And there over the years, we have done some achievements to try to ensure that there's compliance to this surgery protocol. As you know, it's not easy to achieve compliance to pre-operative verification processes, marking the operating site, and doing the timeout itself. So we look at it from the point of engineering approach itself. We look at various ways to enhance compliance. Looking here, we're using human factor analysis. We look at the conditions for unsafe act in terms of communications, in terms of the condition operation. So we try to make the form easier. We try to make enhanced team communication so that we will be able to enhance the compliance rate, which indeed it actually went up. And at the same time, we're looking at how we can spread this culture of high reliability for this safe surgery. So we look at that, and we actually tried a couple of other things to do that. And as you can see here, it was struggling, and then it achieved quite high rates, almost 100%. And that some of the things is really relating to collaboration, effective relationship, ownership of the initiative, integrating it to practice, staff engagement, and senior leadership support are all very important here. And recently, at our Gallup's meeting with the WHO team, LGH, our practice officer, has presented on how to improve the surgical safety culture. They actually re-implemented the surgical safety checklist because they was having a problem, and they tried to improve the culture through education and through looking at the engineering approach to improve that, and they have achieved success in reducing the incidence of surgical issues. Quickly, also, number 4 is relating to, as I mentioned before, patient engagement and partnership. And here we are able, through some of the concepts, engage our patient and partner them. And we form the SingHealth Patient Advocacy Network from a very good group of a very committed patients, which will be identified. Recently, we were able to even come up with a patient and healthcare team mutual care pledge, where we actually co-produce and co-create and actually launch it itself. So this will be a new era in terms of the relationship between the patient and the staff in Singapore. Healthcare education and training is also very important. It's important to look at various aspects of their needs, including patient safety, improvement science, innovation, patient-centeredness, clinical government and risk, and staff resilience and care support. So we provided various programs and workshops to enhance this domain itself. We also make it sustainable by having a the trainers support, as well as master programs, not just foundation programs and skill training programs. We have this trainer so that we can sustain having a group of dedicated faculty and growing our faculty to be able to teach within our own classes system. So this is our system where we would like some of our staff who are very interested to become faculties and conveners of the program. And recently, we also introduced the graduate certificate program, graduate certificate, graduate diploma, and master degrees in patient safety and healthcare quality to empower future-ready workforce to drive patient safety, quality of care, and joy at work in SingHealth and in Singapore. And another very important area is the well-being of our staff. So we look at various domains. As you know, to promote the well-being, you really need to all the domains that will actually affect the well-being, right? Some of them are psychological safety, choice and autonomy, meaning and purpose. These are some domains. It requires multi-pronged approach and the need for prioritization. And we have come up with various programs listed here that we would want to be able to nudge them towards having a good behavior and having a good well-being to do that. And our programs, our patient safety culture building programs are actually leadership-driven, continuous support with leadership role modeling and examples, using realistic environments and contextualized training tools to promote and nudge desirable behavioral change. Number 6, relating to information. As you know, in most of there is 3 aspects towards patient safety. One is risk management, one relates to clinical governance and quality improvement. So we ensure that there's information flow between these 3 pillars of patient safety. We also form expert groups, center of excellence in terms of the various specialized domain areas like medication safety, infection control, and procedural safety, and get the information for them to analyze and to be able to disseminate them ourselves. So we do within SingHealth share a lot of information, and for that matter within Singapore as well, in terms of the risk and in terms of the data relating to patient safety. So basically, we're trying to form a patient safety learning system, and the core of it is a critical incident reporting with structured reporting and analysis. This will be facilitated by a conducive ecosystem of just and psychological safe culture, supplemented with a learning culture, driven by data with good platforms to disseminate. So it's important to be able to ensure that your culture will support your system in terms of patient safety and to mitigate against the counter cultures like blame culture or burnout culture itself. So as mentioned before, this is the patient learning system that we are trying to strive for within all our system within SingHealth. And finally, I'd like to talk something about collaboration. In SingHealth, we are promoting a lot of collaboration, as which, for example, we have the SingHealth Esther Network that's to look into the person-centered care for our patients, is to drive improvement work to better serve our patients and caregivers in the whole healthcare continuum as we go into population health into the community. We have a SingHealth community partnership with facilitate strong partnership, and there's a very active programs, various programs for the neighbors for active living, and that has helped to prevent hospital readmission through the holistic care by healthcare professionals. And we also very keen to build platforms. So here are 6 platforms here. 2 of them local, community learning interprofessional in patient safety and our patient safety quality archive. These are 2 local platforms. And we have 2 other international platforms. That is the Gallup's program, as well as the Journal of Patient Safety and Healthcare Quality. And together with WHO, we actually have the Global Knowledge Sharing Platform for Patient Safety and the Asia Pacific Patient Safety Network, as mentioned by Dr. Neelam just now, which is part of the Global Patient Safety Network. So the Gallup's enhance awareness and promote understanding of the Global Patient Safety Action Plan, and will share best practices as well, as shown here. Best practices, we look at learning sites and try to adopt and adapt them. And these practices will generate evidence to provide further evidence to validate the practices, and we can contextualize the evidence as well. So finally, I just like to mention that Singapore has been through COVID, and we have learned quite a number of lessons itself. And Singapore, in fact, actually did, well, say relatively well, because our fatality rate, as you can see over here, is 0.11%, one of the lowest in the world. And here's our Prime Minister saying that, well, we need to be able to pay tribute to the healthcare workers for battling that. At the same time, must not let valuable lessons from COVID-19 goes to waste. And our lesson here perhaps is that there's need to be a collaboration, the whole of government and whole of society approach. We need to have a resilient healthcare system with an effective public health response using high reliability, a high degree of public trust and commitment among everyone, including with the community partners. And how do you improve trust for healthcare system? Well, you need to make the healthcare workers competent, committed to their healthcare, as well as transparency of the healthcare system. I remember that SingHealth has an error of vaccination, and we're very transparent. We say, well, we made an error, and that actually helps to promote the trust, because we are transparent about things that happens in our healthcare system. So thank you very much. I'm very happy to be able to take questions later on. Thank you so much.